Welcome to this deep dive. We're going to be talking about something I find really fascinating, orthotic fracture management. So, how braces can actually help mend broken bones. You sent over some excerpts from a medical textbook, and I have to admit I was blown away. I'm really excited to dig into this with you.
Well, get ready to be surprised. It's not just about those modern braces we think of. We're talking way, way back ancient history.
Okay, now you've got my attention. Ancient civilizations and braces. I had no idea. Tell me more.
You ready for this? The source we're looking at mentions evidence of orthotic fracture bracing way back in ancient China.
Wow.
It's mind-blowing, right? But I mean, the fact they had that knowledge so long ago, it's just incredible. And get this, even in the 1800s, there's a Dr. Smith, 1855, using hinged devices to treat non-union fractures bones that just wouldn't heal properly.
So even back then, it wasn't just about setting a bone and hoping for the best. They were already thinking about how to actually help it heal correctly.
Absolutely. They were really forward-thinking, realizing that allowing some movement could actually promote healing. It's a concept that really gained traction, no pun intended, with physicians like Sarmiento in the 20th century.
Yeah.
He was super influenced by prosthetic design and applied those principles to fracture bracing.
I can see how that would make sense.
Oh, yeah. One of his big things was this idea of graded function, gradually, increasing the load and movement on the healing bone, almost like a customized physiotherapy program.
That makes a lot of sense. Thinking about it, a cast is kind of like complete bed rest for a broken bone. A brace allows for more of a gradual return to activity.
Exactly. And that's key. That gradual increase in load and movement,
Mm-hmm.
it helps the bone regain strength, but it also keeps the surrounding tissues, muscles, tendons, from stiffening up.
Wow, I never thought about it like that. So we've gone from ancient China to some pretty high-tech, modern techniques. This source actually gets into some specific types of fractures. One that caught my eye was ankle fractures. It talks about how the talus bone, which is a key bone in the ankle, is shaped differently on each side. To be honest, I never even considered that.
Yeah.
So how does that actually impact healing?
It's such an important point, and it really highlights why, detailed anatomical knowledge is crucial here. The talus is like the connecting piece, right, between your leg and your foot, and those slight differences in its shape on each side, they actually dictate how the ankle moves. So when you're immobilizing a fracture, you have to factor in that unique talus shape to make sure it heals perfectly.
It's amazing how these subtle things can make a world of difference.
Absolutely.
Now, the source also mentioned the Lodge-Hansen classification for ankle fractures. Can you shed a little light on that for us? Why is it significant?
Sure. The Lodge-Hansen classification, it's all about understanding the mechanism of the injury, how it actually happened. The position of the foot, the force involved. It classifies ankle fractures into four main types: supination aversion, supination adduction, pronation aversion, and pronation abduction.
So each type kind of tells a different story about how the injury occurred. And I'm assuming that impacts how it needs to be treated.
You got it. Knowing that mechanism helps doctors figure out how to reduce the fracture. So basically, getting those broken pieces back in the right place and then figuring out the best way to immobilize it so it can heal properly. For example, the most common type is called supination aversion. That usually happens when the foot is forced into external rotation. So to treat that, you actually have to do the opposite internally, rotate the foot, and then immobilize it.
It's like putting a puzzle back together, but with much higher stakes.
Exactly.
So it really is like detective work, figuring out all the pieces of the puzzle to get that ankle back to normal. Now, you mentioned immobilization. How long are we typically talking about for an ankle fracture to heal?
Well, for that supination aversion fracture we were just talking about, usually it's about 6 to 8 weeks.
Okay, so a couple of months off those feet.
Yeah, and this is where, that unique talus bone shape really comes into play. Making sure it's positioned correctly during healing, it's crucial to prevent stiffness later on and ensure everything lines up perfectly for that ankle joint to move smoothly.
It's fascinating how these small details can have such a big long-term consequences.
For sure. And it's not just the shape, but the actual position it's held in while it heals. The source recommends keeping the ankle neutral, or even adjusting it to a plantigrade position right before the bone fully heals.
Plantigrade. I remember that term from anatomy class, but refresh my memory. What exactly does that mean?
Basically, think of a flat foot. Like when you're standing normally.
Right.
It's all about helping the ankle regain its full range of motion.
Makes sense. Now, the source also points out that even with this detailed Lodge-Hansen classification, not all ankle fractures are created equal. Some are just inherently more stable than others, right?
Absolutely. It specifically mentions that for stable ankle fractures, so the ones without displacement, meaning the bones haven't moved too far out of place, a shorter period of immobilization might be enough. They even talk about using a walking cast in these cases, which allows for, some careful weight bearing and movement early on.
Ah, so it's really a judgment call based on the individual injury.
Exactly. The key is providing enough support for the bone to heal properly, but not restricting mobility any more than you absolutely have to. And of course, this is always a decision made between the doctor and the patient.
Right. Always best to leave those decisions to the professionals.
Yeah.
Now, in the cases where a brace is recommended, is there like a standard ankle brace or are there different types?
Oh, there are actually quite a few. The source mentions some made from metal cable, others from more flexible plastics. The designs can vary too. You've got single-axis designs, which allow for movement in just one direction. And then there are much more, I guess you'd say, complex ones. It really depends on the specific fracture and what stage of healing we're talking about.
It's amazing how much nuance there is in this field. It really isn't a one-size-fits-all approach. Speaking of which, the source also talks about tibial plateau fractures. Now, those can be pretty complex, right? And it even hints at some controversy around using braces for these. What's the debate all about?
Right, so tibial plateau fractures, those are the ones that involve the top part of the shin bone, the tibia, where it connects to the knee joint.
Right.
Those are definitely tricky. And yeah, in medicine, there's often debate about the best way to manage these injuries. Some experts, like Sarmiento, actually thought these might be a contraindication for orthotic management. He was mostly concerned about maintaining that perfect alignment of the fracture.
So he wasn't a fan of braces in those cases. I can see why alignment would be so crucial there.
Exactly. But on the flip side, you have experts like Delamarter who are all for orthotic management. They believe it can be used effectively for all kinds of tibial plateau fractures.
So strong opinions on both sides. What are the factors that might influence the decision in those situations?
A lot of it comes down to the individual patient, the specifics of their fracture, the surgeon's experience and preference, weighing the potential risks and benefits. But the source does point out some general principles. For example, it mentions that when you have a tibial fracture and the fibula, that's the smaller bone in the lower leg, is still intact.
Right.
It says that when weight is applied, the broken ends of the tibia tend to shift inward towards that intact fibula.
So it's almost like the fibula is acting as an anchor, but it's pulling the tibia out of alignment.
That's a great way to put it. And that's just one of many things that doctors have to think about when they're deciding on the best course of treatment for these really complex fractures.
You really start to appreciate how interconnected everything is in the body. How something seemingly small can have a huge ripple effect. Now, we've covered ankle fractures, tibial plateau fractures. The source also touches on femoral fractures, which, if I'm not mistaken, can be really serious. So what makes orthotic management different in those cases?
Yeah, you're right. Femoral fractures, those are the ones in the thigh bone.
Right.
And those definitely present some unique challenges.
Right.
Because of where they are, the forces involved. There's a much higher risk of the bone shortening as it heals, which can cause a whole bunch of other problems down the line.
Shortening of the bone. Yeah, that doesn't sound good. What kind of impact can that have long term?
Well, it can affect your leg length, how you walk,
Yeah.
even put more stress on other joints like your hip and knee. Yeah, so with femoral fractures, orthotic management, using a brace, it often comes later in the game.
Yeah.
It's not just about waiting for the initial swelling to go down like with some other fractures.
So it's a lot more delicate.
You could say that. Often you need to stabilize the fracture first, maybe even address any shortening that's already happened before you even think about a brace.
How do they even go about stabilizing a fracture like that in the femur?
Well, the source talks about traction as being a crucial step.
Okay.
This might involve, using weights and pulleys to gently pull on the leg. It helps realign the bone fragments and try to restore that proper length. It's kind of like taking a step back, making sure everything's in its right place before you start pushing for movement.
So you're saying it's about creating the ideal environment for healing before you even introduce a brace.
Exactly. Think of it this way. You wouldn't build a house on a shaky foundation, right? Same principle. And even when a brace is the right call, the source is very clear that keeping that knee joint mobile, it's super important.
Why is that so crucial, that knee mobility with a femoral fracture?
Because if that knee joint stiffens up while the bone's healing, it can really hinder your recovery later on, make it that much harder to get back that full range of motion once the fracture is healed. So it's all about finding that sweet spot, that balance between stability and mobility at the right time in the right way.
It really makes you appreciate the complexity of it all. This whole deep dive has been eye-opening. It really highlights how intricate fracture healing is and the crucial role that orthotics play in that whole process.
It really is remarkable when you think about it, how something like a brace, seemingly simple, is actually backed by, well, centuries of knowledge and observation and a deep understanding of how the body heals.
It's a good thing we have experts like you to break it all down for us.
Mhm.
Thinking about all the different factors involved, it makes me wonder what happens if things don't go exactly according to plan. Like we've talked about that delicate balance between stability and movement during healing. But what if a bone doesn't get that right kind of movement? Could it actually heal in a way that's permanently weaker or less flexible?
That's a really interesting question. And honestly, it's something researchers are still trying to fully understand, but it definitely is possible for a bone to lose some of its range of motion, or strength
Yeah.
if it's immobilized for too long, or if, rehabilitation isn't done properly. It really highlights the importance of, following those doctor's orders, doing the physical therapy to really get back to that optimal
So
function.
it's not just about healing the break, it's about healing it right.
Exactly. It's about getting back to doing the things you love, hopefully without any limitations. And that often means a whole team effort, the right orthotic, targeted exercises, and a gradual return to activity. It all works together.
So in a way, it's like having to learn to walk again after a serious injury. You're retraining your body, your brain to work together seamlessly.
Love that analogy. It really is amazing how adaptable our bodies are.
Yeah.
And with the right support, the right guidance, they can overcome some pretty incredible challenges.
That's a great note to end on. This has been a truly fascinating deep dive into the world of orthotic fracture management. I know I've learned a ton, and I'm sure our listeners have too, so thank you so much for sharing your expertise with us.
The pleasure was all mine. I'm always happy to talk about this stuff. Hopefully we sparked some curiosity out there.
And for everyone listening, we hope you've gained a newfound appreciation for all the work that goes into mending bones, that intricate dance of healing, and, of course, the remarkable role that orthotics play in helping us get back on our feet. Until next time.